Well, whenever I see an infertility couple, they always tell me, well, doctor, we have been taking treatment for 2-3 years and we have not reached a diagnosis. We really don't know why we are not conceiving. And that goes categorized as unexplained infertility. But unexplained infertility really exists? I'm not so sure about it. I feel a lot of reasons are hidden and they're not tested upon. Or a doctor has to be very proactive, which we are in Sunanda Fertility Clinic, in making diagnosis of the cause or the etiology of the infertility. And some of the factors which have a delayed diagnosis would be as follows. One of them is Mullerian problems. That is the uterus having certain shapes which are by birth, certain shapes are there which could delay your pregnancy. And many times these women come to us with 1 or 2 abortions, and then the test will detect, well, the uterus has a different shape and it needs to be corrected. For example, the uterus could be a septate uterus, like a septum in the middle of the uterus, or it could be a T-shaped uterus, and this patient would be going from door to door, doctor to doctor, saying that, well, I'm unexplained infertility, which is not. Then how do we detect it? It is simply detected by a 3D sonography. Is it a special sonography? No, not at all. It is a routine sonography. So at Sunanda Fertility Clinic, every patient undergoes a 3D sonography transvaginally to detect these Mullerian problems, T-shaped uterus, much earlier, much earlier, so that you don't have a delay in diagnosis. Then the second reason is abnormalities of the myometrial thickness. Have you ever seen, just go through your pages of sonography reports and you will find the thickness of the myometrium is not mentioned in your reports. But that is one of the major determining factor. How fast will you achieve your pregnancies? If the myometrial thickness is between 1 to 2 centimeters, you could have a normal pregnancy. But somebody who is having a myometrial thickness beyond 2 centimeters, the chance of pregnancy drops down. Just go through the report and again see, have they mentioned about the presence of the junctional zone of the uterus on sonography? And that's the thing. If the junctional zone is disturbed, that is something which needs correction. That is something which needs a different outlook and different treatment protocol, rather than sitting on that patient without declaring or without diagnosing a junctional zone problem and keep treating them one after the other. It's just waste of money. Forget the money. It's a waste of time and the precious emotions are lost. One of the other reasons there is endometriosis. Endometriosis is a disorder wherein the lining of the endometrium is shed out and it forms pockets outside the uterus, and it needs to be detected much early. And how do you detect it? A simple sonography, a simple transvaginal sonography can pick up the smallest of an endometrioma, or a simple clinical examination telling you, is there a uterosacral nodularity? Is the uterus fixed? Will tell you, is this a case of endometriosis? And that can be picked up much early. You need not do a laparoscopy. You can do a therapeutic test by giving some tablets for a month. And if the patient is relieved of symptoms of pain and dysmenorrhea, well, you could be facing endometriosis and you should do an early laparoscopy to diagnose the same. And last and not the least is a decreased ovarian reserve. The patients have bunched up files after files without testing for ovarian reserve. What's the point? It is the ovarian reserve which should be done at a primary testing, which should be a decision-making factor of what kind of treatment this patient is going to need. Well, I hope this helps you out. And for any further details, do not hesitate to contact me at Pristine Women's Hospital, Kolhapur. Thank you.